Hi, everyone. I'm Pam Sheeran. So great to be with you today during CleftCon. Thank you so much for having me. I can't wait to talk to you about Sumatra's sustainable approach to global cleft care. It's an extremely important topic for me. I've been at Sumatra for almost 13 years, and what brings me to work every day truly is my belief in our approach to global cleft care. So this is a refresher for most of you. Most of you know this, but it's important to start off to say that our approach is singular. It's focused. It's only on families affected by cleft lip and palate. And our approach is also sustainable. So in this picture, you can see that not only the sparkle in the eyes of the young child who received lip and palate surgery, but also the sparkle in the eye of the cleft professional. And I could say it's incredible to watch transformation of a child before and after surgery, but also it's incredible to see the transformation in a local medical professional when they have the resources on hand to be able to provide the care they've been so well trained to do. That they don't move away somewhere, they don't leave their community, they stay there and they're all able to offer top quality cleft lip and palate care. It's their passion, it's their dream. So this is really important to our approach to global cleft care. It's not a fly-in, fly-out model. It's sustainable. We empower local medical professionals. We call them partner medical professionals. We empower local hospitals to have equipment, the resources that they need. The next aspect of our approach to global cleft care is that it's scalable. So this focus on empowering local medical professionals is what has brought us to be able to scale over the last 21 years to all these countries that you see on the map. So when I joined Smile Train 13 years ago, we were pretty early and we were still in startup mode. So we were in a good number of countries and we partnered with a few hundred hospitals. But really those hospitals were the training hubs. They were the sites where the universities or the leaders in cleft lip and palate care. We were making sure they had everything they need to train the next generation of cleft professionals. And so as cleft professionals graduate from their programs and move to other areas of their countries or maybe to nearby countries, we're able to follow those newly trained professionals and so help support them as they start their own local cleft lip and palate team. So this type of scaling approach, all through the empowerment model, has made it possible to say that we've been able to treat children in more than 90 countries over the last 21 years. And you can see from all these little blue circles, we're also extremely measurable. So 21 years ago, we were founded by a business professional, and that said that we need to be able to measure the impact of what we're doing. We need to be able to measure our investments. And so that's where, right from the beginning, we made sure that we were tracking every child that received care, every partner hospital that we were working with, every medical professional that we were working with, so that we can tell our supporters everywhere where their investments are going. And also we can show to our patients that they're getting the best quality of care possible. So still in the same theme of being founded by a local business professional 21 years ago, we have these systems. This is really important to our approach to global cleft care. If we're scaled to more than 90 countries and we have programs around the world and there's cleft lip and palate surgeries and comprehensive cleft care services are being provided throughout the day across all time zones, we need to make sure we have systems and structures in place so to make sure that, again, we're being accountable to our donors, that the investments are being made wisely, and also accountable to our patient families so they're getting the best quality of care possible. So what are these systems? From a programmatic perspective, these systems are as followed. First, we have very strong medical protocols in place. And these protocols, we are standards of care documents. And we actually have our partner hospitals and local medical professionals sign them like contracts to say, this is the standard of care that we promise to provide through the Small Train funding. We also have many resources as far as education and training so that we can continually advance the level of care that's being provided and keep up with the latest and greatest research. So that's one pillar of a system and how we work. Another pillar is we have annual surveys and reports that are required by all of our local partner hospitals and medical professionals to fill out, to complete on a regular basis in order to continue to receive the financial support that they receive. And these annual surveys and reports are extremely important to our systems at Smile Train, again, to make sure that our investments are being spent wisely, but also for us to be able to see where additional needs are, how we can adapt and change given the realities on the ground. Now, the other top right, they say regular site visits. We have Medical Advisory Board. That's a global medical advisory board of the best and brightest cleft experts And we also have medical advisory councils that are local in each region. And these council and board members all continually look at the quality of care being provided. And they can actually do safety and quality audits at partner hospitals at any time. But it's also really important to mention that at Smile Train New York headquarters, where maybe many of you are familiar, we have a very robust team across marketing, finance, programs, donor relations, where we all work as a team. But we also have really important team members that are based strategically across all the major regions where we have local partners. And these are Smile Train local staff, and they're from those places where they're based, and they know the realities on the ground, and they can again do local site visits to make sure the partners are using the funding as intended, and also that they have all their needs are being taken care of to be able to provide the best quality of care. These local Smile Train staff are eyes and ears on the ground, an extremely important part of our systems of making sure that our approach is local, our approach is efficient, and our approach is really working, again, as efficiently as possible. And now the most really cornerstone system for us is something called Smile Train Express. And this is our online medical database. And we launched this in 2001, all with the support of our founder, and also with support of our global partners. So this online medical database, we record every single treatment that's been supported by Smile Train to every single patient in this database. We now have more than 1.5 million patients in this medical database, recording their surgical, their pre and post surgical photos, also speech therapy recordings, orthodontic records, nutrition records. And what this system does for us is that we're able to show our donors or supporters the patients are benefiting from the generous donations, but we're also able to leverage our medical advisory board, our local medical advisory councils, and to be able to check the quality of care that's being reported in the system. So every day as care is being provided, we're able to see the care being provided and be able to say, is this the best quality of care possible for these patients? It's an extremely important system for us. So on the earlier slide, one of the systems I talked about was annual surveys. And this is a glimpse from our 2020 partner survey, where we asked, what is your biggest need as far as comprehensive cleft care? And our partners responded that the biggest need in yellow, you can see, is speech therapy support. After that, in purple, it is nutritional support. And then after that, in red, you see orthodontics. And these three areas of comprehensive cleft care are actually the three areas that we've been investing the most in the last couple of years, and that we plan to continue to invest in moving into the future. This survey helps us every year see what are the trends and needs from our partners. How can we make sure that our programs that we're funding on the ground are responsive to that, are flexible, are really showing the needs on the ground. And that brings me to our next slide that shows the menu of grant programs that partners can apply for. So depending on their local needs, one partner's hospital is going to be very different from the next partner hospital. And what we like to say through our local staff around the world is, what do you need? Let's discuss. And we have this menu of different grant programs where we can adapt and we can offer you different types of support as you need, so that you can offer the best quality of care for the population of cleft patients in your communities. So starting in the top left, we have awareness grants where partners can actually apply for support to run a radio campaign, or to do have community health workers go to the community and hand out flyers, so that families know where to go to receive care. They know that when a child is born with a cleft, where they can go to immediately get help. We also have equipment grants. So if a partner hospital says, we don't have access to new surgical supplies or to orthodontic supplies from our hospital, and the only way to get that is through support from Smile Train, and they can ask for a grant for that. For training, this is the cornerstone of our grant programs, because as I mentioned, our local empowerment model. And a really great example of this is around speech therapy. We've found globally that speech therapy is not something that the speech therapists are not people that we can actually easily find. They're trained in cleft and palate. So we've invested in speech therapy training around the world over the last few years, and we need to continually do that because it's a really important area for our partners. And so our partner hospital can come and apply for funding to host a local training, or Smile Train, our local staff, can actually organize the training itself. But this is a really important grant program for us. And as we continue, there's research grants that partners can apply for, so they can find out and they could do research on what aspect of care, what approach to care locally renders the best results for their patients. The central grant surgical partnership is our largest grant program that's actually paying for the surgery itself at the local partner hospital. But then the next grant you see on the right of that, the travel and meal stipends, this is something that people don't realize is so important to actually making sure the surgery can take place. A lot of times we hear that our patient families can't afford to stop work for a day to travel to the partner hospital to be evaluated for care, let alone then go back home because the child is not ready yet and have to come back at a later time. It's just not, this is not feasible. So our partners have asked for support through the years in order to have travel and meal stipends, and we've created a new grant program because of that. And actually, that input came directly from the field, from partner surveys early on, and that's why we developed that grant program. In red, you can see the comprehensive cleft care programs. And as I mentioned on the earlier slide of the survey, these are areas of greatest concern right now for our partner hospitals. So we're really trying to help our partners grow and invest in these three core areas: speech, nutrition, and orthodontics. And for speech therapy, oftentimes the grants need to cover the supplies for the speech therapist, travel for the patients to come to and from speech therapy, and even for the time of the speech therapist themselves, because often it's not an area that the hospital has normally prioritized. For nutrition, it could be, again, to make sure that there's somebody on staff to be able to offer the counseling and the feeding support for every mother that comes in with a new baby born with a cleft. The nutrition grants can also support bottles or specialty feeding supplies, or supplements for babies that as they need to get stronger prior to surgery. For orthodontics, oftentimes the grants cover the equipment, the supplies around orthodontics that the child needs and the team needs and they don't have access to otherwise. The idea that those three areas of comprehensive cleft care brings me to this slide to show that smile training, another really important aspect of our approach to global cleft care, is that we're comprehensive. We're not interested in just a once and done surgery for a child. We are interested, we're dedicated to making sure that every child has access to comprehensive cleft care. And speech, orthodontics, and nutrition have been our core comprehensive cleft care areas that we've started to work on the last few years. But as time goes on, we plan to continually grow into all the areas of comprehensive cleft care to make sure that every child has the best quality of care possible. Another important aspect of our model, of our approach to global cleft care, is that we leverage technology. I've already talked about SmileDream Express, our global medical database that's online. We also have developed through the years speech apps, which are actually right now available in Spanish and English, and they're for free in the Google Play and also the Apple stores. And they focus on sounds that are very challenging for children with cleft palate, even after they receive surgery. So these apps offer a fun, interactive way for children to practice their speech therapy at home. And we encourage you all to check it out and please spread the word. We hope to develop more of these apps as time goes on, especially in our new reality in the global pandemic. And that brings me to this important point about our approach to global cleft care. Again, we're flexible. And so with this global pandemic, we're even faced with our partners needing to cancel cleft surgeries, with the needing to really move any of their rehabilitation services all online. SmileTrain's been there for them. And so not only with speech therapy, but also with counseling of new parents, of the patients themselves, with group sessions so that our partners can also guide the parents on how to do, for example, the taping of pre-surgical infant orthopedics. But we've heard so many success stories around speech therapy in particular that telehealth has been an extremely important way to keep connected to our patients, to make sure they're getting continual care. So also that they know that when things begin to open up, that they have their cleft team they can go back to and get in-person care as needed. So from April to July alone, that's what you see these stats on the page in front of you that we've recorded. But we know our partners are even going well and above these numbers that we've been receiving from them. And this is something that SmileTrain, we've been trying to financially support our partners as needed with their telehealth grants through a new special grant program. Perhaps we're going to begin to call it a telehealth program, but for right now, we have a special grant program to add to that menu that you saw earlier. And we'll be continuing to try to hear from our partners, to innovate with them, to hear how we can continue to support them through this pandemic, and so that they can make sure their children are able to receive the best quality of care. The new areas for comprehensive cleft care that we plan to move into beyond speech, orthodontics, and nutrition are oral health and dental care. And on the left, you can see this guidelines document that we just launched actually last month with FDI, which is the World Dental Federation. They're helping us create new guidelines for oral health and dental care over the course of a lifetime for a person born with a cleft. And aside from this strategic partnership with FDI and our hopes of expanding to oral health and dental care, we're also looking at supporting a few key partners in ENT and hearing grants, so we can explore the ways that we can effectively and efficiently support our partners to have that aspect of care available. And of course, we're also looking into new ways around psychosocial support for our patients. And we look forward to sharing those with you because we know this is an extremely important area for families worldwide. So thank you everyone for tuning in to hear more about our approach to global cleft care. I really appreciate everything you do for Smile Train. It's an honor for me personally to work for Smile Train, but also to be here with you today. So thank you so much. Enjoy the rest of your day.